Hi, I'm Dr. Bruce Roberts. I'm an integrative medicine physician here at the Institute for Health and Healing in San Francisco. I'm going to be talking to you today about achieving your health goals and how to make those New Year's resolutions stick. Statistically, about 50% of adults in this country make New Year's resolutions every year. And if you're one of those 50%, I want to commend you for your intentions and your good efforts. But unfortunately, I've got some bad news for you. Statistically, about 45% of you will have given up on your New Year's resolution by the end of January. Within 6 months, only 8% of you are still going to be following your resolution. That means 92% of you will have given up. The typical person will make the same resolution for 5 consecutive years before they finally achieve success. So what I'm going to talk to you about today is what steps that you can take in order to increase the odds of you being one of those 8%. One of the problems that people have is that they think that change happens in a straight line, that you go from point A to point B, and there's no detours in between. But really, the process of change is a spiral path. It's a series of going around in spiral circles with taking 2 steps forward and 1 step back. And you could think of each of these turns around the spiral as kind of like a death rebirth experience. You're giving up parts of yourself that no longer fit and moving into something new. So an interesting model for looking at how we go through change is the birth matrices. And in this model, it's really using our own birth process as the energetic template for what it feels like to go through change. And this can give you a real kind of visceral feeling for what it feels like to go through change. So the first birth matrix is called the water matrix. It corresponds to the first couple of trimesters of pregnancy. And you can imagine yourself as a fetus floating in nice warm water in the amniotic fluid with an umbilical cord attached, bringing you everything that you need, taking away everything you don't need. Everything's just going smoothly at this point. The second birth matrix is the earth matrix. In the earth matrix, you're in the 3rd trimester of pregnancy. You're filling up the space, kind of stretching out, feeling what fits for you, what doesn't fit for you. You're doing your work, going about your day-to-day business, but there's a sense that the space is getting a little bit small and that maybe this isn't going to be a place where you can stay forever. The third birth matrix is a fire cycle. This is a time of lots of activity. This corresponds to the time in pregnancy of active labor. At this point, the walls are coming in on you. The cervix is still closed, so you can't see any light at the end of the tunnel. You recognize that something's going to have to change. You can't stay where you're at. You can't keep doing what you've been doing, but you have no idea what it's going to look like on the other side. This is a stage where women are often calling out for the epidural to try to take some of the pressure off. If you have behavioral addictions, this is a time when you might increase your addictive behaviors in an attempt to get back to that water or that earth matrix. The next birth matrix is referred to as spirit. This is a time of surrender, when you recognize that you're going to have to move forward, whatever the consequences are. It's a time of kind of let go, let God, and you sort of relax into it. And in the relaxation, the cervix opens up, and suddenly you start moving down the birth canal, and you're born into the 5th birth matrix, which is air. And we go through this cycle over and over again in our lives. We go through it from going from infancy to adulthood, going into relationship. We go through it with jobs, and we go through it with trying to make behavioral health changes. Another way to look at this, another model is called the cycles of change. There's a pre-contemplation cycle, contemplation, preparation, action, and maintenance. So how do you know what stage you're in? Well, if you don't think you have a problem, you're in the pre-contemplation stage. If you recognize that you have a problem and intend to take some sort of action within the next 6 months, you're in the contemplation phase. If you recognize that you have a problem and are planning on making a change in the next month, you're in the planning phase. If you've taken action on the problem within the past 6 months, you're in the action phase. So if you're one of those who has made a New Year's resolution and is in the process of making the change, you're now in your action phase. If the problem's been solved for more than 6 months, you're in the maintenance phase. So what does the pre-contemplation stage look like? Well, at this point, you don't recognize that there's a problem, but other people may see that you have a problem. You have no intention of making a change. And at this point, you may feel like you're not the one that needs to change. Other people need to change. If they would just stop bugging you about the problem, you would be just fine. Or you may feel stuck in this stage because you feel demoralized. Maybe you've tried making a change in the past and were unsuccessful, or you just feel like the situation's hopeless. Some of the defense mechanisms that keep us stuck in this stage are things like denial, the problem doesn't exist; minimization, it's not so bad; rationalization, well, my behaviors are justified; projection, you're the one with the problem; or internalization, I'm hopeless, I can't change, it's just no good. So how do you help someone who's in the pre-contemplation phase? Well, turns out that fairly regularly patients come to me in the pre-contemplation phase. And when that happens, it's usually a spouse or a parent who's encouraging them to come in. And they come in and say, no, I don't have any problems, but my wife thinks my drinking's a problem, or I should stop smoking or doing something else. So the task during this stage, you're not going to be able to make someone go from pre-contemplation to change, but the task is to raise consciousness about the behaviors, help them to begin to start exploring the pros and the cons of continuing the behavior. And really what we're doing during this stage is just planting seeds or planting corn, hoping that the seeds will germinate and grow, and that the patient may at some point in the future be ready to take some change. Another thing we can do at this is get them to take a look at their coping mechanisms and start teaching more effective coping mechanisms for dealing with their stresses and the things that trigger their behaviors. An important part of holistic medicine is a concept that our symptoms are our teachers. Our body is always trying to tell us when things are out of balance physically, emotionally, and spiritually. And a lot of what we do with our unhealthy behaviors is to kind of self-medicate, to cover up the symptoms that our body's trying to teach us about. And in doing that, we're really not helping ourselves out. Our bodies are always working towards healing. Our body's always trying to give us messages. And if we begin to pay attention to those messages, we can begin to recognize where we need to make changes. You don't want to wait until the messages are so strong that you don't have any options. You don't want to wait for a heart attack or a stroke or a brain tumor before you decide to finally make some changes. As a good friend of mine once said, there's better living through chemistry or better living through better living. So it's better to pay attention to the symptoms early and make the lifestyle changes that will treat the underlying problem rather than just covering it up with unhealthy behaviors. So you're now moved out of the pre-contemplation phase. You're in the contemplation phase. You acknowledge that there's a problem and there's something that needs to change. So this is a time where you begin thinking about how you might solve the problem. It's a time where you can begin to educate yourself and gather information. There may be some fear of failure at this point. It may be easier to just think about the problem rather than taking action. But you're trying to get to the point where your motivation for change outweighs your motivation to stay the same. And so it's important to become aware of both the positive and the negative consequences of the behavior. If you've developed a behavioral pattern, it's obvious that at some point that behavior has been beneficial to you. At some point that behavior has been a friend to you. And so you want to begin taking a look at it. What are the pros and the cons of the consequences of the behavior to yourself? What are the things that it does for you in a positive way? What are the things that it does for you in a negative way? What are the pros and cons for the behavior to other people? Trying to see it from other people's perspective sometimes can get you past the denial or the minimization. And another thing to look at is, how do you see yourself as a result of the behaviors? Are your behaviors consistent with your current values, with your current sense of integrity? And how are other people seeing you in terms of this behavior? So once you've got through this, once your perceived benefits of changing are greater than the perceived benefits of staying the same, you move into the preparation stage. At this stage, you want to resolve any ambivalence that you still have about making change. If you're still holding on to some old defense mechanisms, you want to really take a look at those. And at this point, you're going to move from the decision to change to a more active making specific steps to solve the problem. You don't want to skip over this preparation stage. A lot of people who make New Year's resolutions go from the pre-contemplation where they sort of looking at a problem to the pressure of January 1st comes running around and you just decide to make a change and you skip over this whole preparation process. And that's a big part of why people fail to make those New Year's resolutions stick. So in the preparation phase, you're beginning to turn away from old behavior. You're beginning to let go of that concept of yourself as someone who smokes cigarettes, somebody who sits on the couch for hours a day and watches TV, somebody who doesn't exercise. And you're beginning to look to the future. You're beginning to see yourself as the person who has made that change and take a look at what your life looks like once you've gone through that birth canal and have made the positive change. So this is a time to make a list of the benefits of making the change and post it somewhere on your mirror, or if you're one of the changes you're trying to make is around your eating habits, you may want to post it on your refrigerator. And it's important to make your change a top priority. If it's 15th or 20th on your priority list, it's not going to happen. Change is hard to do, and I really recommend making the change one of your top 3 priorities. You can put your family first, your work second, but this needs to be up there pretty high on your priority list if you're going to have any success. And it's important to remember that you don't have to make the change all at once. It's okay to take small steps that don't feel so overwhelming and let those steps build to an ultimate goal. This is a time of gathering supplies, both emotional and physical supplies that you're going to need to make the change. It's a good idea to write a written plan of how you're planning on going through this change, setting a specific date of when you're going to make the change. New Year's Day is sort of an arbitrary date that people often set, but it may not be the most appropriate time. Your New Year's resolution may be that I'm going to spend the next 3 months in preparation for a change that I'm going to make later on, and make sure you're really ready to make the change. And finally, when you're ready to make the change, go public. Tell as many people as you can. If you're keeping this a secret, your chance of being able to go back to old behaviors is going to be that much greater. The more people you tell, the more you're going to have the motivation to stick to your commitments. As you tell other people, that also gives you an opportunity to ask for support. You don't have to go it alone. It's a good idea at this point to assess the consequences of the change. Whereas previously you were assessing the consequences of the behavior, now you're looking at what are the pros and cons of making the change. You're starting to look forward. How is it going to affect other people if you make the change? And how are you going to see yourself once you've gone through the birth canal and you've seen the new person that you've emerged into? And how are other people going to see you when you've made this behavioral change? Okay, you've gone through the preparation process. You've done everything you can. You've got your plan all set, and you're ready to start making the changes. At this point, the benefits of making the change are clearly outweighing the perceived benefits of staying the same. People who have looked at this have shown that when the benefits seem to be about 2 to 1 of making the change versus staying the same, that's when you're going to be more likely to be able to be successful. So this is the time of clearing out the cupboard and getting rid of all the sugary foods, throwing the cigarettes away, pouring the last beer down the drain, getting the last remnants of gluten out of the house, whatever it is that you're trying to change, this is the time to do it. And it's important to remember that this action step, although it's an important step, isn't the first step in the process of change, and it's not the last step. Stephen Covey, who wrote 7 Habits of Highly Successful People, talks about the idea of habits having a gravitational pull. And he describes the process of preparing for a rocket launch. A lot of the energy, a lot of the planning goes into setting things up before the launch, but the biggest amount of energy is during the first minutes as a rocket's lifting off the Earth's gravitational pull. There's more energy spent in those first few minutes than are spent in the rest of the 500,000-mile trip to the moon and back. And so this action phase, you're working against gravity, you're working against the pull that this habit has had for you for a long time. So make sure you're ready to take that action step before you take it. There are some tools that can help you in the action phase. These are referred to as countering, environmental control, rewards, and buddying up. Countering means that you're substituting healthier responses for the problem behaviors. One of these is active diversion, and you can do this by keeping busy or refocusing your energy. So find other types of activities that you enjoy doing that you can do as a substitute for what you're doing. A good countering technique is to do physical exercise. Physical exercise helps reduce stress. It helps build the endorphins. It helps decrease the anxiety that may have been a trigger for your behaviors. But it's important to make exercise fun. If exercise is feeling like a chore, it's not going to happen. It's going to be one more behavioral change that you're not going to be successful at. But for a lot of people, getting involved in an exercise program can really help with whatever other health changes you're trying to make. Relaxation exercises like meditation or breathing exercises, yoga, tai chi, can be really helpful. Most of our unhealthy health behaviors are designed in one way or another to help reduce stress, tension, or anxiety. Most of us are not spending our time in the present moment feeling relaxed. There may be issues from the past that come up or concerns about the future that create anxiety or tension, and our unhealthy behaviors are coping mechanisms that we've learned that help temporarily to mitigate that anxiety, to help bring us temporarily into the moment, to give us something to focus on rather than focusing on those other problems. So exercise and meditation are both healthy substitutes that can teach you how to stay present in the moment without having to rely on those old behaviors. Another technique is counterthinking. That is to become aware of where you're having negative self-talk or irrational self-statements that are triggering negative emotions that are going to make it more likely that you're going to go back to that old behavior. Counterthinking can be combined real effectively with meditation. When we meditate, we focus on our breath, or we focus on a mantra or some kind of saying that keeps us in the present moment. And then somewhere along the way, our mind takes us either into the past or into the future. And as soon as you recognize that you're no longer in the present moment, you just, without judging yourself, without criticizing it, you just gently bring yourself back into the present moment. And if during meditation you realize that there's some negative self-talk coming up, then that's an opportunity to become aware of it and see if you can substitute healthier self-talk rather than the critical parent that we carry around inside of us. Another countering technique is assertiveness. Assertiveness is one of 4 ways that we express anger, but it's really the only way that creates more closeness and helps resolve the problem. And assertiveness can help counteract tendencies towards codependence. And by codependence, what I mean is a tendency to put other people's needs ahead of our own. Most of the people I'm talking to right now are Sutter employees, and we're involved in the healing profession. And those of us in the business of helping other people have probably come by our codependency tendencies honestly. Somewhere along the line, we've learned that there's benefits to taking care of other people. We've learned how to put their needs first. But if you do that consistently without taking care of yourself, your own well will eventually become dry. If your well is dry, you're going to be more likely to try to fill it up with the unhealthy behaviors and habits. A final technique that I want to talk about is EFT, or emotional freedom technique. This is an acupressure tapping technique that I use all the time in my office. And it's based on the idea that we have an energetic body that holds our stress and our tension, and that we can release the stress and tension through tapping at the beginnings of the different energy meridians in our body. I wish I had a full seminar that I can talk to you just about this technique, but I will give you some resources at the end if you'd like to find out more about this very helpful technique. The next technique is environmental control. Avoidance is important. Obviously, if you're trying to give up alcohol, hanging out at bars and hanging out with your drinking buddies isn't going to be very helpful to you. If you're trying to change your eating behaviors, going out to buffets isn't such a good idea. Cues are things in the environment that are a little bit more ubiquitous. They're a little bit more difficult to avoid. So a strategy for dealing with cues is to allow yourself to gradually be exposed to these cues, and rather than reacting in the same kind of reflexive way that you've done in the past, is to practice response prevention. Just plan for and practice a different type of response when these cues come up. You can also set up reminders around your house. You can create signs to remind you of your commitments. You could create to-do lists that give you a list of other things you can do instead of the old behaviors. And if there's any paraphernalia associated with your old behavior, if you're trying to quit smoking, if you've got your ashtray and your cigarettes and your lighters and you put them in your closet, you've already lost half the battle. You're already kind of telling yourself subconsciously that you're planning on failing. So get rid of the paraphernalia, clean up your house, get rid of anything that can pull you back into the old behaviors. The next one is rewards. And the rewards just help reinforce your new behavior. One type of reward is covert management, and that's just using positive self-talk and encouraging self-talk. In a way, this is kind of reparenting yourself, treating yourself the way a healthy, supportive parent would treat you as you're trying to learn a new behavior. Another one is to contract, and you can set up healthy rewards. You can set interim goals along your way to achieving your ultimate goal. And you can set up reward systems that once you get to this point, there's some healthy reward for reaching that goal. And you could also ask friends and loved ones to offer you positive feedback to help reinforce the changes that you're trying to make. And remember, you don't have to do this alone. Our society tends to really value independence, but this is a place to recognize that what's most important is interdependence, that we can't do these alone, that it's easier to do it with support. So if you have a partner who's still trying to make similar changes, or you can find somebody who's trying to make similar changes, partner up with them and do this together. Come up with a plan together. If you don't know anyone who's trying to make the same change, you could still find a friend who can share some of the countering techniques. Maybe someone to play tennis with you, or someone to go to the gym, or to go for walks in the morning. You can set up formal contracts with your family and friends and let them know their best way to respond to you. They may not know the best way to respond or to support you. So let them know. You might even want to put it in writing that when this happens, this is how I would like you to respond. Ask for what you need. And finally, you could find a support group. It seems like there's support groups for just about everything out there these days. Or you could find a 12-step program to give you a more formal process for moving through each of these steps. Okay, so you've made the change. You've survived the first 6 months. You've beaten the odds. Now you're in the maintenance phase. So this is a time to kind of consolidate the gains you've achieved in the previous stages. But it's important also to be vigilant and to prevent lapses. A quote from A Tale from Two Cities: "It was the best of times, it was the worst of times," kind of describes what it's like during this process. You've made the change, you're feeling good about it, but there may be a lot of old feelings and emotions that were being covered up by the old behaviors that start bubbling up to the surface and wanting to be released. And that may be creating more anxiety and more tension. So there may be a tendency to fall back into old behaviors. So what helps in this time is to recognize that, again, that your body's always trying to work towards healing. And so if these feelings are coming up and bubbling up to the surface, don't look at that as a problem. Look at that as an opportunity to do some deeper healing. You can do this through EFT or through meditation, or if you need to, you could work with a formal counseling program or a 12-step program to help you move through these issues and actually heal the old issues that are coming up rather than just covering them up with those old behaviors. Some of the danger signs during the maintenance phase is that you may have unresolved grief. It's important to remember that this behavior was really a very good friend to you. It was there when you needed it. For people who are trying to quit smoking cigarettes, that little break during the day where you smoke a cigarette is maybe the only 2 or 3 minutes where you're fully present in the moment, where nobody's bugging you, where nobody's criticizing you. So recognize that your old behaviors are friends, and you can create a ritual to mourn the loss of your former friend. It's okay to do this, to recognize that something that had been there for you before is no longer there. But just as we outgrow our friends sometimes and need to move on to friends that are supporting a new vision of who we are, a new vision of our current values and sense of integrity, sometimes we need to give up those old friends and find new friends. Recognize that during times of increased stress, you're more likely to fall back into old coping mechanisms. Be aware of old friends. We all get used to sort of developing certain orbits around each other. And when you make a change, you're kind of pulling yourself out of the orbit, and that throws everyone else out of balance a little bit. So there's going to be a tendency for those old friends to maybe try to pull you back into the more comfortable orbit so that they feel more comfortable around you. And finally, you want to watch out for overconfidence. This may be the point where you say, you know what, I really licked this problem. It's okay to have some alcohol in the house just in case company comes over. Or it's okay to have some cookies or sweets just in case so-and-so comes over. So there's always a possibility of lapsing and relapsing. And it's important to recognize that if you do lapse into old behaviors, you don't need to fall into a full relapse. You don't need to judge yourself or criticize yourself. You can avoid catastrophizing the situation or absolutist black and white thinking. It doesn't mean you're going to go fully back into the old behaviors. But if you do find yourself lapsing, take responsibility for it and realize that, well, this just indicates that there's a certain degree of vulnerability, that you're going to have to increase your vigilance. You can reassess the high-risk situations, develop a plan to guard against them. And you can see the slip as an opportunity for some deeper healing. What is it that still is trying to come up to the surface that's triggering that anxiety that triggered this relapse? And then as soon as you're aware that you've gotten off the track, just gently guide yourself back on track and start over again. So I'd like to just say a few final words. All of us are going through a major transition with the medical system at this time, and that's creating a lot of stress and tension for a lot of people. Recognize that the same tools that help you make a health behavioral change can help you through this transition as well. So what you want to do is take the time to figure out where you are in the process. Are you still in denial about the process? Have you not accepted EPIC as something that's our reality at this point? Or are you still having resistance? Or are you still having defenses against making these changes? Take the time to learn the tools necessary to move through this process. Prepare carefully for the action stage. And when you're ready, take the plunge. But by all means, make sure that you're gentle with yourself and gentle with other people in the process. We're all going through this change together. In a lot of ways, the whole medical system is in that fire cycle right now. We're going through a birth process. What we've been doing in the past is no longer working. We're not sure what the future is going to look like, but we're going to somehow go through that birth canal together, and we're going to survive it, and we're going to come out stronger on the other end. So lastly, I just want to mention a few resources. A lot of the material for this talk came from a book called Changing for Good. And if you want to look deeper at this, find out more about it, I'd really strongly encourage you to read this book. Some of the information came from a classic book, The 7 Habits of Highly Effective People by Stephen Covey. And this is an excellent book that really talks about a lot of the principles that I talked about today. And finally, the book, The Tapping Solution, is an instruction guide for EFT. And if you want to find a really useful technique for helping to decrease the energetic pull that's keeping you stuck in old behaviors, the tapping solution in EFT can be real helpful. So I want to close with a final quote: to watch your thoughts because they become your words. Watch your words, they become your actions. Watch your actions because they become habits. Watch your habits because they become your character. Watch your character because it becomes your destiny. Thank you all for listening. I hope this was helpful.